started due to everybody's time constraints. Want to make sure that we enjoy our last couple hours here on Friday. And with that, before we begin, I want to just say again how proud we are of our educators out there that have begun the education process. Thank you so much to the administration, your principals and teachers out there, to the administration, Chuck Huckleberry, Dr. Garcia, Dr. Cullen, everything that we have done as a team, and our united front going forward will be most appreciative. And to all of the community members out there, thank you for being respectful and bearing with us during these times. And with that, we will go ahead and do roll call. Ajo Unified School District, Superintendent Dooley. No. Alter Valley, Dr. Dumont.
Dr. Dumont is on.
Yeah. Amphitheater, Todd Yeager. Baba Kivri, Dr. Morris. Catalina Foothills Unified, Dr. Bartlett. I see her there. I believe I see her. Is she on? Denise, are you there? There you are. Okay. Continental Elementary, Roxana Rico.
Present.
Thank you. Flowing Wells Unified, Dr. Baker.
Here.
Pima County Joint Technical, JTED, Kathy Prather.
Here.
Great. I saw Dr. Streeter, and again, welcome to Pima County. We're glad you're here from Marana. Thank you, sir. Sarita, Dr. Valenzuela.
Yes, sir.
Gotcha. Sunnyside Unified, Mr. Holmes is in the room. Good to see you, Superintendent. Tanca Verde is in the room. Dr. Hagman, good to see you, sir. Tucson Unified, Dr. Trujillo. Yeah? No. And Vail Unified, John Caruth. I don't see him either. Okay. Arizona College Prep Academy, Miss Mendoza. Presidio Schools, Jessica Monteith.
I'm here.
Southern Arizona Community Academy, Larry Speda. Thank you. Southgate Academy, Sylvia Camelot.
Here.
Great, thank you, Sylvia. The Gregory School, Dr. Julie Sherrill.
Here.
Catholic Diocese, Sherry Dahl.
Here.
Imago Dei Middle School, Cameron Taylor. Okay. And South Point Catholic High School, President Sullivan. No. Okay, with that concludes roll call. Dr. Garcia, we'll turn the floor over to you. And Dr. Cullen.
Thank you, Superintendent Williams. We have a pretty busy agenda today with the goal of trying to finalize the consensus that I believe that we developed during our last meeting. And that will start with the first item, which is an affirmation of the public health principles that we presented to this group of educators during the meeting on Monday. I'm going to turn that over to Dr. Cullen. The action we're going to ask you to take, we asked you at that meeting to communicate to us if you had any concerns or misgivings, or if there was any reason why you could not support and we have not received any negative responses. All the responses that we received, both in the chat and in emails, have been very supportive. What we will ask one more time is if there's any concern or any reason, hesitation why we shouldn't go forward with those, then it's our opportunity to get those articulated. We will not be asking for a vote per se, because it sounded like it was very much the consensus of the group, and I don't think that there's a need necessarily for a vote unless you so desire. So I'm going to turn it over to my colleague, Dr. Terry Cullen.
Hi, thank you, Dr. Garcia. So I just want to briefly go through these principles to remind you once again what they are. The first is just equitable outcomes, basing our decisions on state and local public health guidance, which you will see today, the integration of science in decision-making, the ability to the facility to ensure appropriate isolation of symptomatic students and protocols, which we will talk about later today also, the protection of community members, individuals and their families, and the consideration of the harmful effects of school closure, which we are all well aware of. So with that, based on what Dr. Garcia said, given that we did not receive any other feedback beyond what we received on Monday during the session itself, I think that we can assume that these are affirmed by this committee unless there is someone who would like to speak to that now.
So this is the opportunity for those of you in that are members of the committee to register any concerns or objections, and I'm going to open up the floor to any comments to that effect. On the other hand, if you're just generally supportive, you can just sort of send me a thumbs up on the chat or visually here in the room. So thank you. It sounds like we haven't had a single thumbs down. So we're going to affirm those principles, and we appreciate that. It's very much, from my perspective, motherhood and apple pie. So the next item is the discussion and affirmation of the public health criteria to be met prior to the transition to a hybrid model of in-person, in-school learning. Really critical. One of the asks that this committee made of us last time was to make sure that our criteria here in Pima County aligned as tightly as possible with the state. To that end, Dr. Cullen and I, after some consultation with our team, have decided that given that our own disease criteria, that is the first 3 items on our dashboard, two of them are nearly identical to what the state has promulgated. And the third one, we are just going to go ahead and adopt the 3 state articulated criteria as our disease criteria for Pima County. So we won't change, we have already changed our graphic to reflect that. We hope that this decreases any ambiguity or any confusion on the part of parents and educators and certainly our school leadership community. But we believe that is a relatively easy thing to do. So based on that, one of the discussions was how do we move from phase to phase? And one of the things that we want to make sure we, again, re-articulate is that to move into this hybrid model, and this hybrid model meaning that a substantial number of children continue to be learning at home, that most of your at-risk children and your at-risk adults continue to work remotely or virtually. Under what circumstances can we all sort of start thinking about moving into that next phase? And when all our indicators are in that yellow zone, at that point, the school district or the individual charter school or the individual school has the option to move into that next phase of instruction. Can you do some of this even ahead of time? Absolutely. The decision to in terms of your instructional program is entirely in your hands, in the hands of your school board. But that will be, when we are all in the yellow is when the health department and the county will signal that we are ready for hybrid instruction. So I'm going to be quiet there. And did we want to show, is this where the PowerPoint is? Okay. And we're going to go through a couple of slides, but I'm going to ask if there are any questions. I think, this is a good time to ask questions if there are some in the chat box or in the chat box. Kay Sullivan from South Point has joined us. She wants to let us know that she can't unmute or use the video, but she can hear us. So, but I don't see any other questions or comments in the chat box. I'm going to look at our superintendents who are physically here present to see if there are any comments before we go forward. See none, I'm going to turn this over to Dr. Cullen. And
Slide 4.
sure.
And you should have gotten a copy of this. Once again, we apologize that you may have gotten it a little late. You can go back up one.
Going to try to move us out of.
Yeah, so this was the reopening guidance. We shared this with you last week, and to reiterate what Dr. Francisco has said is from the state and from our perspective, you would need to be moderate to move through here. You'll recall cases can be absolute number of cases or cases 10 to 100 cases per 100,000. What's important to note is if you recall last week, the case report from the state was yellow for Pima County. The case report that got released last night is now red. And we have actually talked about this a little, about this going forward and going back. The report yesterday was based on the number of cases per 100,000, which is actually what we would endorse from the county perspective. Percent positivity remains in the red here, and COVID-like illness is now in the green. And you did receive a secondary report that has that on it from today. Next slide. And you can go to the next slide after this. These are the current recommended return to school but that we adopted from return to business. This is what this looked like last week before we modified this yesterday. You'll recall we had cases, we had deaths and hospitalizations. As we've talked about, we want to align not only with schools but also with businesses. The state is using these 3 disease criteria in both of those instances. So by adopting them and changing the second and third one, we're now aligned with the state for disease criteria. You will also recall, however, that the state did not propose any healthcare capacity criteria or public health capacity criteria. Next slide.
I'm going to sort of make an editorial
Yeah.
comment here for the superintendents and the educational leadership at the table. Part of the reason why we think this is important, the discussion last time was that we heard from you loud and clear was, Francisco, Terry, tell us when you're going to have people to help us out if school X has a case or if school district Y is dealing with this type of an issue. And that's what the public health capacity criteria are about. When we are in the yellow zone, it will mean that we will have the resources that we need to begin to deploy to support your facilities. Same thing with the healthcare capacity, quite honestly. Because of the level of community transmission, because it is still substantial, we need to have a healthcare system that has sufficient capacity to take care of people who end up needing hospitalization, end up needing testing. We believe we're making good progress there. That's why you see all our indicators in the yellow zone, but we still have some ways to go. So I just want to provide that clarity.
Yeah, thank you. That it's really critical. And the other thing I would say is that I don't know what word we used this morning, Dr. Garcia, but we're zigzagging a little. We're seeing one step forward, one step back, and we do expect to see that for the next, hopefully just a brief period of time. So that's why these become really important. We just talked about this, how we took 7 out of the 9 criteria. We are keeping them. We are changing to the disease data, % positivity, and COVID-like illness. Next slide. This is the updated disease criteria from this week. This is actually not an accurate slide. I think we may have an old deck. Anyway, just so you know, COVID-like illness is green. It's not criteria not met. The first 2 not met are cases and % positivity. And the important report that you have is a secondary handout, a 1-pager, and that is accurate. Next slide. This just goes over what the change in the cases means. I don't think we have to spend a lot of time on it. The one thing I would urge you is to recall that there is a 12-day lag time. So the data that was reported by the state yesterday from the 13th is the time period up through 8/1. So that lag time is to reflect the amount of time it sometimes takes for us to get the accurate disease data, including positivity rate as well as the case prevalence. Next slide. And % positivity, you know we've been running above 10%. It's around 11 to 12%. Next slide. And COVID-like illness, we've talked about this before. This is a pan-county report for the southern counties. It's primarily driven by Pima County and the reports from the emergency room visits that occur in Pima County. Next slide. Okay, so I think at this point we would like to have the discussion about the affirmation of using these criteria, the 9 criteria that you now see that align with the state for disease, include healthcare utilization as well as public health tracking and prevention. So are there any questions? That might be the best way to do it.
I just have one question. Thank you, Dr. Cullen, Dr. Garcia. It seems to me that when we do kind of what you said, the zigzag and go back and forth, this is going to cause in the future, which obviously your recommendation was 5 to 7 weeks of students coming on campus. Will there be any way that we could ever judge that? Because if a school does get the green lights, we definitely don't want to see schools opening, reopening, closing, back and forth. That would send a really bad message, obviously, to the students and the communities. How would we ever start to gauge that in some sort of capacity?
So a couple of ideas, Superintendent Williams. That's part of the reason why we don't want to be strictly reliant just on the 3 proposed disease criteria that the state has promulgated. And because, in fact, why we've taken a relatively conservative approach that we need to be in the yellow zone both for healthcare system and public health care capacity. I think that will allow us to mitigate that whipsaw. We don't want to go back and forth. That's also part of the reason that even though we can technically produce for you school district specific maps and tables showing you disease in your area, that's part of the reason why we don't believe that that's a smart strategy. We think that it is probably better to act as a cohesive whole. Having said that, the other element here is to allow us to be sufficient time in that yellow zone before you actually take action. So what you'll hear us say is, once we hit the yellow zone, we're going to say, geez, we've had our first week in the yellow zone, we've had our second week in the yellow zone, 3rd, 4th week in the yellow zone. You guys start to make plans to bring your kids back. Does that make sense?
Yeah, perfectly. Thank you very much.
And the one other comment I would make, and it's related to the one that flipped from last week. Remember, this is the number of cases. The state used absolute number of cases. We were concerned about that because we were still over 100 cases per 100,000. If we're consistent with which one of those we use, which may mean that occasionally the color we give ourselves may be different than what the state chooses to give us, I think we'll see less of that because the 100 per 100,000 is a much larger playing field as opposed to dropping from 1,000 to 999. absolute numbers.
They
So,
can't seem to fix it for me. I'm not considered panelist.
Any other comments from the superintendents? We want to make sure that we give you guys the maximum amount of flexibility, and we want you to be able to understand when you're in a safe zone, but understanding that yellow in Sunnyside may look different from yellow in Tanque Verde, and that each school district, certainly each charter school, and hopefully each school in general, takes that advice as kind of the starting point for making their own implementation plan. Superintendent Hagerman.
I just have a question about the COVID-like illness. It's like the one area that's green right now. Is it something that when it's flu season will be, or is it really just looking at COVID, or when you have flu and COVID, it becomes a number that goes up?
It has two, you are seeing the COVID-like illness. We also track influenza-like illness. So there are two different distinct reports that come from the emergency room. While we recognize that there is crossover between the symptoms, we will be relying on the providers in the community because that is where that data comes from. So I think we're going to have to wait and see what happens as we move into influenza season.
But in theory, they're two separate things.
Yes.
They would come as a two separate
Right.
report, not squished together.
Other comments or concerns from the superintendents, from the principals or directors? Superintendent Hagerman?
I just have a question about the 5 versus 7 in terms of positivity rates. And that's the question I get most often in terms of what number we should be using to kind of make a determination.
In terms of the percent positivity?
Right.
We have been relatively firm and consistent that we believe that the safe criteria is 5%. That when we are below 5%, we can be all very comfortably said to be in the green territory. When we are in that 5 to 10%, we are in the yellow territory. Dr. Cullen, do you want to amplify or clarify?
I think what's important to note is the data would support that the safe moving forward from international experts is 5%. That seems to be the number we've heard repeatedly. The state has chosen 7%. I think we may have mentioned this last time. Remember, positivity is dependent upon what the denominator is. So, and people that are seeking testing. In Tucson, we still are not seeing any testing saturation, which is what they are seeing in other counties in the state, and you're probably seeing the reports nationally. There's reports of testing numbers falling off. If the testing number falls off, there's this belief that the sicker people or people that are more symptomatic will choose to get tested, and so you may elevate your percentage of positivity there because your denominator is smaller. In our case, we have not seen that. I do think that this will be something we will revisit as we go along. We have seen our positivity rate decrease minimally, go from 12%, 11%, 10%. So, and actually that's positive for the community, but we are not in the yellow range right now.
Other concerns or questions? Again, I'm going to ask the county administrator to comment. One of the things that we believe is that the school districts need the maximum amount of flexibility. In keeping with that theme, the Arizona Border County Coalition has sent up a message to the governor today that I think is apropos of this discussion, that I believe it would be good if Chuck shared with you guys.
Yes, Dr. Garcia, and I think all of the superintendents, we've included a copy of that letter, I believe, in the package of materials. If not, we can get it to you. But in essence, what it does say is that in this discussion about returning at-risk students to classrooms on August 17th is probably too broad a brush. as it did not do any analysis with respect to the physical capacity that each district may have in its facilities or classrooms, and still meeting those public health guidelines on physical distancing and other measures. And that probably the first step was to determine the actual amount of in-person at-risk students who could be returned to a facility. And that particular point, you're going to have a number that you could safely accommodate given the standards that are being promulgated from public health officials. That then would then require you to do an analysis associated with your at-risk youth, to perhaps rank them in risk order, and then to try and match those that have the highest risk with the available space. And at some point when you run out, it's unsafe to continue to put at-risk youth in those facilities. What is being suggested in the letter is that school districts be given additional flexibility with regard to making those determinations, and we were hopeful that there'll be at least some answer. The letter used as an example the predicament that the Nogales Unified School District is in, and hopefully that will be recognized by the governor, his staff, and the Department of Education. So that was just happened yesterday because, again, the coalition of counties on the southern border were having some difficulty, and I think they were then asked to weigh in. This communication was crafted for them and then unanimously approved and signed by all representative county members to the coalition.
Thank you, Administrator Huckleberry. We believe, a fundamental belief is that we believe that the school districts themselves or the schools are in the best position to understand both their physical plant, their staffing, and their other resources in terms of risk mitigation, and that you guys need to have the maximum amount of flexibility with regards to that. There's a comment in the chat that I will share with you from Jessica Monteith Pools, and her concern is that how will we address those folks in your school district who travel to or across different locations. We have many families, just as other districts, who travel to and from Phoenix, Nogales, Mexico, et cetera. That's part of the reason why we think it's really, really critical that we be relatively conservative in terms of our recommendations, in terms of when we tell you that it's okay that we're in the yellow zone and that it's okay to proceed with the next level of instruction, because to pretend that what happens in Phoenix doesn't impact us here in Tucson, or what happens in Nogales doesn't impact us here in Tucson would be a fiction. So it's a good comment from Ms. Monteith Pools. I think we will move us to the next part of the agenda, which is the issue that you brought up at the end of our conversation last time. And you wanted to have some concrete support and concrete commitments on the part of the county in terms of what we could do to assist school districts and schools to be successful. So I'm going to turn it over to Dr. Cullen.
Yes, we've been spending a lot of time on this, some of it in response to what we know you need, some of it with the recognition that the role of the health department is to support you, to ensure that returns are as safe as they can be, that transitions meet the best science knowledge that is out there if we harken back to the principles that was embedded in there. What we want to do now is just talk to you about what the proposed Pima County Health Department role is. A lot of this, even though it says proposed, we've already initiated, and we've been working with either you or your health staff or other representatives from the different members that are concerned about what is happening in the schools. With that, I'm going to ask Brian Eller, and hopefully you guys can unmute him, to present this. Many of you who have been on some of our previous webinars have heard from Brian. He's been taking the yeoman's part of this for me to make sure that we have it available for you. So
If we
he
can
is on the phone, so
If we can
make
unmute
him
Brian, I will
available.
continue to forward the slides. I will continue to move the slides forward. And even though you may
can't.
not specifically know Brian, he's been part of the school health initiatives since for a very long time, and so your staff, specifically at the school level, knows this individual. And so, Brian, I'm going to turn it over to you. You tell me when you want me to advance the slides.
And let's see if you're unmuted. We don't hear you, Brian, if you're speaking. Brian, you want to try? I actually can do these slides if need be. No? Okay, so let's go forward. I do want to acknowledge Brian, though, and the small team we have working on this. They've been doing amazing work, and our goal is to make user-friendly, human-centered design documents that you can use. We've been working closely with the state, with other districts, with other counties, as well as the CDC data that we've been able to get. So you saw part of this slide last time. We just want to reiterate it a little more. The proposed role, you have asked us to make this easy for you, which we totally support, that you have a name that you can call a real person. And you can see, if you can look at the chat, is that we have identified a new public health nurse that is coming on to help us. Penny Gomez, she has previous experience as a school nurse. She will be our public health nurse lead. Brian and other people will facilitate and be on this team, but she will be the one, and we will send out contact information. I do anticipate that this team will need to expand as we go along, that there will not just be one person. However, she will have a support staff to help delegate specific work to, and you can see here we are at this point proposing that we will have 7 CT as contact tracing staff available to assist the schools with their contact tracing efforts. As you know, our contact tracers are being stood up right now. We have approximately 120 contact tracers. If we need to shift more people to the school because there are certain situations that develop, we will do that. So suffice it to say, our goal will be to get the cases identified quickly, and we'll work with you on that. Ensure that the contacts can be done and identified quickly, and work with you to meet that 1-1-1 timeline, 24-24-24, with the goal of stopping transmission of the epidemic, the pandemic. We also will deploy a school interface as a fully accessible resource. There'll be PDFs, and there's other planning links already available there. We will be updating them on a regular basis and adding to them. We will support the attestation, and you guys have heard this before from us, that if we can get your plans, we will review them. We are distributing a self-attestation form, which we will review in conjunction with you. Our goal here is, once again, to provide support. This is not an endorsement. This is not a pass or fail. This is, what else would we recommend you do? And once again, we anticipate that those mitigation plans and recommendations from us will change over the course of this school year as we all learn more. Finally, we will support school distance learning with health-enhancing instructional material. Our goal is to make sure that we can share what we know about health with you, your staff, your teachers, your families, and your students as the COVID epidemic changes. Next slide. So the next slide gives you an example. Oh, Are you there, Brian?
Yes, I made it. Thank you all. Sorry about the technical difficulties there.
Brian, I'm sorry to interrupt. I already did the very first slide, so we're on planning, assessment, and tool, if you want to go from there.
Okay, great.
Thank you.
Yeah. So thank you everyone for joining in today. I apologize again for the technical difficulties. So in terms of the actual solid work that the health department has been doing to try and assist you all to get through this, one of the main tools that I want to talk about right now is this planning and assessment tool, which all of your either employees at the administrative level or your district staff should be getting. This is a 16-page document that's really going to serve as a checklist. What you see here layered over on the 3 pages are screenshots of that checklist itself. The checklist goes through in a pretty detailed fashion various levels of mitigation strategies that the health department suggests be implemented at your school site in order to reduce the spread of COVID-19 among your students and staff should you choose to return to either hybrid or traditional face-to-face instruction. Again, it's condensed from many of the other guides that we've seen out there to 16 pages, and its intention is really as a foundation for the planning and return for that return to schools. Next slide, please. So I want to show you an example of how we actually intend to use this as a planning tool. On your right-hand side of the screen, again, you'll see a screenshot from the actual document itself. This is under the hygiene and sanitization guidance subsection of that planning document. If you look at the supplies pop-out box there, ensure adequate supplies to support healthy hygiene behaviors, so on and so forth. On the far right-hand column of that box, there's a yes or a no checkbox. On the left-hand side of the screen, this is how we intend to have those little sections serve in the actual plan itself. So you can copy and paste from this, pull it over, and put it into your school district plan. The planning language changes in the sense that it might say something along the lines of School District X has contracted with fill-in company here to provide appropriate supplies for staff and students to ensure healthy hygiene behaviors. Staff will be provided, and then insert a number, masks every semester. This is not, making it a semester requirement to provide masks is not a recommendation. That's just what we put in to give you an idea of what that planning may sound like. A secondary example of how this could serve in a planning document is in terms of the label directions for appropriate dilution rates and contact times, which is where your janitorial staff or custodial staff would be trained. The planning language changes in the sense that you would say custodial staff are trained on chemical hazards, manufacturer's directions, Cal OSHA requirements for safe use, and as applicable and as required by the Healthy Schools Act. The team of school liaisons, of which myself, Tabitha, and Penny and Dexter are all a part of, will be working in conjunction with some folks from the University of Arizona to act as a technical assistance capacity as you go through this planning document with the rest of your school sites. So if you come across a section where you have questions or there's not a full understanding of what that specific section is talking about, you can refer back to our team through eoceducation@pima.gov, and we will connect with you as soon as possible to ensure that you have the appropriate understanding of what the county is recommending as a mitigation strategy according to this planning document. Next slide, please. And I want to leave off on this final slide here because I know that there's been a lot of questions and concerns about the Executive Order 2020-51, which is the return to school issued by Governor Doug Ducey, the Arizona Open for Learning. The important points on this that I want to touch on is where the health department has overlap within this executive order. Things, for example, like where districts and charters may adopt procedures to ensure physical distancing and mitigation strategies, which is in Section 3C of that executive order. The health department, through the document we viewed previously, can help you think critically about what those procedures and mitigation strategies will actually look like in the implementation at your school site. Another example is in Section 3D, where a waiver may be applied for under circumstances of quote-unquote outbreak or adjacent tribal sovereign nation issuing stay-at-home orders. We know that there's several jurisdictional municipalities that border upon those tribal sovereign nations, and several of your school districts or schools may also border on those lands. So it's important to note that this executive order allows for an exemption of that. We are searching to try and really get some very specific guidance from the state and Arizona Department of Education on how the health department supports that specific waiver piece. So look for that upcoming and future technical assistance sessions that will be occurring on Tuesdays and Thursdays of every week. The last piece of this where there's overlap is in Section 4C and in Section 5, subsections A, B, and C. The mitigation plan, again, which we referred to through that planning document, of which we'll be providing out to all of you, the 16-page document that goes into pretty good detail of that, along with the mitigation policies, are required by school districts. And again, the health department wishes to serve in a technical assistance capacity to schools as you develop those plans. That ends this section of the actual slideshow itself. Dr. Cullen, I think if you want me to go on mute, we can maybe turn to questions.
Yeah. Thank you, Brian, for that. Hopefully this gives you some insight into how we plan on approaching this so that we are accompanying you through the next school year and make sure that we are available for you. In addition, if there are other specific technical questions you have, clinical questions, please feel free to reach out to us and answer them. Brian and our staff have been facilitating these webinars twice a week. I actually am always amazed at the number of questions that are very well thought out. Some school districts submit the questions ahead of time so we can make sure that we can respond to them. The one thing we didn't mention yet is we are putting them into an FAQ site. So we will be able to have frequently asked questions. So people that have a new question and or haven't been able to come to one of those sessions will be able to find the answers. So thank you.
Dr. Baker, Superintendent Baker from Flowing Wells has a comment in the chat, and that has to do with our, what is our definition of at-risk for the purposes of this. And I realize that we all get sort of caught up in our own jargon. Initially, in my brain, at-risk, when I was thinking about at-risk children, the initial thought was those children who were medically frail or otherwise sort of compromised. But really, it's a much broader definition and encompasses kids who have a lot of other social and emotional support needs, are impacted by poverty, and are impacted by challenges with behavioral health or transportation issues, et cetera. We want this to be a very broad definition of at-risk kids. I think that serves the school districts and the schools well to keep it broad. But if there is a feeling that we need to narrow it down, we can come up with a more narrow definition. But we think in this case, less specificity is better. It gives you more flexibility. I don't know if there's any comments from the superintendents with regards to that issue or not.
I just have a quick comment or question. I think this is probably the most contentious part of the governor's executive order that completely contradicts the medical advice of our professionals like yourself. And schools are going to be put in a really precarious situation, which is come Monday, there will be a demographic that shows up on site. And, obviously we're asking the parents and everyone out in our community that if you can stay home and do remote learning, that is the number one option that we would like you to do, because number one, we know you're safe. And number two, our medical professionals sitting in the room here today have told us that it is not safe to return to school yet based on the metrics. With that said, I kind of want to back up so I can understand the policy here for the proposed Pima County Health Department role. Can you walk me through what that will look like? So if I am a school and I do have a scenario, who would I call and where would I go? What would that look like? So if something happens, say as early as Wednesday of next week, what does that process look like?
Yeah, thank you for that question, Superintendent Williams. It's an excellent question, and we believe we are prepared for that. So the EOC education is an email box that comes to about 4 of us, so people will be monitoring that routinely. In addition, we will make sure that we push out a phone number that can be used for people to call if there is an acute situation. For instance, a symptomatic child, and the health staff or the staff that's there are concerned about what to do with that person. And what you'll see if you go to the website, and many of you have already shared your plans with us, and we know you have a plan of what to do. Remember, one of the major things of the principles is that if someone is ill, you have a way to isolate. It's really, that is the major thing, to isolate initially and then get that individual to a safe place depending upon what's wrong with them. But for instance, then you go, well, did I just have an outbreak? Is that an outbreak? What do I do now? Our staff will be available to answer those questions and walk you through them starting tomorrow. We've been fielding a lot of questions this week from a lot of the different school districts, so Superintendent Williams, I feel comfortable that we will be able to respond to it. There are a few questions, just so you know, though, that have come up, and I want to just highlight one of them because I don't have a good answer to it, and I've been asked it. When do you close a school? So not when do you close a classroom, when do you close a school? And one of your staff from the districts is who asked us that question previously. We don't have an answer to that. There is no, I know this might be hard to believe, but there is no CDC guidance for that. I asked the state that in the last 24 hours, and the best I can come up with is that we will work with you. We will assess this based on the number of people in your facility that may have been diagnosed with COVID or have been exposed to COVID, and come through discussion and dialogue with you to what is the best recommendation for you at that time. I myself, as a numbers person, was seeking, okay, is it 5% of the classrooms and 2% of the student population and 2% of the staff? I cannot get that number, and we actually are engaging in some pretty intensive review of the literature to make sure that when we make a recommendation, we have it accurately. But that's why this cooperation between our staff and you will be so critical. The one ask we would have is to contact us early. If there's anything you're worried about, we would rather hear about it at the front end of it. If you have any questions, please feel free to reach out to us.
To that end, we have a couple of comments. First from Superintendent Trujillo, who talks about the executive orders not just contradicting public health recommendation, but contradicting each other. And I think we all sort of recognize the dilemma that puts us all in. Mr. Huckleberry, I know that you had a comment.
Yes, Dr. Garcia, I would suggest that we do define the at-risk component, simply because traditionally we've used at-risk dealing with economically disadvantaged or bilingual learners or others. I would hate to have this interpreted that a medically at-risk child should attend. That is just exactly the opposite of what we should be saying, so we probably need to clarify that.
Good point. I wanted to give Dr. Valenzuela, Superintendent Valenzuela from Sahuarita, an opportunity to make a comment. I know he was trying to be recognized. Can you unmute him, please? Superintendent, can you hear us?
Yes, sir. Good afternoon. Thank you so much, Dr. Garcia. Just a quick comment and a quick question. One, thanks to you and your college for all the hard work, and in particular with the work you've done to align the disease criteria to be very strongly aligned, in fact, a mirror image of the state's guidelines. I think it just helps all of us to communicate and create clarity, which is so important in this effort. My question is specifically about some of the other indicators regarding public health capacity and healthcare. What do you think is the probability that those variables will keep pace with hopeful and foreseeable shifts in the disease criteria. They seem like things that are more kind of outside the realm of the disease trends themselves and kind of have to do with availability of resources and people to be able to intervene and support. So I'd be interested in your thoughts about that. Thank you.
Superintendent Valenzuela, that's an excellent question. Honestly, I actually think that we are, as you can see from the color chart, we've actually made more and consistent progress on some of those other criteria as compared to some of our disease criteria. I actually think that there is a good likelihood that we will continue to, I know for a fact, for instance, that we are improving every day in terms of our investigation and our contact tracing. So I know that those are going to get better, and those will continue to improve. I believe that they will not, if the concern is, will those things hold up the progress to the yellow zone, to some form of hybrid in-person instruction? I do not believe so. I believe that if anything, they will be yellow before the other indicators are.
Thank you.
Other comments?
Can I follow up on that? This is Dr. Cullen. I want to echo what Dr. Francisco said. The Board of Supervisors in Pima County has been very supportive of the needs we have for testing, case investigation, and contact tracing. We believe, and I would once again echo what he has stated, that those will not be the impediment for us to get to all yellow. What's important to note, however, is that the impact on us getting to yellow when we have high disease transmission, because what that means is that we have more cases to investigate, more contacts to reach, and we need to do that. This metric requires us to do that within 48 hours, which is where we want to be. That's really important. So if anything, they will probably be at one point be hand in hand as we go forward.
There's a comment in the chat box from Mr. Spade and Ms. Dahl with regards to the definition of at-risk populations. The concern being that each school/district needs to define this. Our populations are often very different. Most of our schools have already established at-risk students. We're not going to tell you what to do or not do. What we're going to try to do is be very precise in our own language so that when you read at-risk in a document that comes from Pima County, you understand exactly what we mean
Hey,
by
pretty good.
that.
I'm just stepping out just real quick of this Pima County Health Department meeting.
Yeah, that's a meeting.
I'm going to have the regionals calling into you to let you
Pardon me,
know
can you
what
please mute
schools
your phone?
have what and what are missing what. John's deadline is 4 o'clock.
Can you find out who that is and mute them? Thank you.
I wonder if there's any other comments before we move forward. I think I'm not seeing a whole lot of other comments. Jessica Monteith-Pools talking about perhaps we can have more specific parameters that allow districts to have some control over the definition within the parameters. Charlene Mendoza, I respectfully disagree about each district or LEA addressing different populations. It's important for us to address this as a public health issue as risk is defined differently in medical and educational fields. That's part of the reason why I'm saying, we know that risk means something different to different people. We want to be very precise by what we mean when we use that term risk, and we will be as precise as we can so that you don't have to second guess. What was Francisco thinking when he said kids at risk? We hope to be most helpful in that way. And then obviously at the end of the day, the decisions about school moving forward in different phases is up to you. And we are here to support you and to make this as safe an experience as possible. Are there any other comments before we conclude our meeting today? Superintendent Williams, anything else that we need to do?
I believe not. I think right now this has been some excellent information. Again, I want to just thank all of the education community for what you have done in this remote learning opportunity that we have in front of us, and working together as a united front is going to be our most important attribute. Also, to the parents and families out there, we want to thank you for what you are doing with your children and your sons and daughters. And if there is any doubt, please stay home and do remote learning as long as you possibly can, and let our medical experts figure this out as we continue this process. Thank you very much.
And I will add my admonition to the superintendents, which is we are still in the midst of a very troubling time. We are still not out of the woods. If this is I keep saying, if this is a marathon, we're at about the halfway point. That still means there's a long way to go. And we need to be very cognizant that wearing masks, keeping physically distant, staying home when we're sick, all those things are really essential elements for us to continue to improve as a community. Pima County's epidemiologic data seems to indicate that we're getting better little by little, but that progress is not set in concrete. That progress, it will be precarious unless we can continue to engage in these mitigation measures. With that, I'm going to take the prerogative of thanking you for this, and again, appreciate your time. We'll adjourn this meeting at this moment.